Hi viewers, this is your Endless Nurses World. இன்னைக்கு இந்த வீடியோவில் நம்ம என்ன பார்க்க போகிறோம் அப்படின்னா ப்ரீவியஸ் இயர் இமேஜ் பேஸ்டு கொஷின்ஸ் இது வரைக்கும் என்னென்ன கொஷின்ஸ் இமேஜ் பேஸ்டு கொஷின்ஸ் கேட்டிருக்காங்க அப்படிங்கிறத இந்த வீடியோவில் பார்க்க போகிறோம். ஒவ்வொரு பிக்சருக்கும் ஒவ்வொரு இன்ஃபர்மேஷன் கொடுக்குறேன். இந்த வீடியோவை பார்த்து தெரிஞ்சுக்கோங்க. வாங்க நம்ம வீடியோக்குள்ளே போகலாம். ஃபஸ்ட்டு கொஸ்டின் என்ன கேட்டிருக்காங்க அப்படின்னா ரிமூவல் ஆஃப் ஆர்கன் என்சர்க்கிள்டு ஷோன் இன் ஃபோட்டோகிராஃப் மோஸ்ட்லி லீட்ஸ் டு டேஸ் இன்ஃபெக்ஷன். The organ shown in the photograph is spleen. The options are Streptococcus, Pneumococcus, E. coli, Salmonella. The answer is Pneumococcus. The role of spleen, the functions of spleen. Main functions, three functions. It stores blood and it filters the blood, removing the waste products of malformed, damaged blood cells and bacteria and viruses, and it produces it produces antibodies to fight infections, and it maintains the levels of fluids in our body. These are all the functions of spleen. Next question, instrument shown in photograph is used to assess options: environmental heat measurement, cooling power of air, mean radiant temperature of surroundings, relative humidity of air. So this instrument shown in the photograph is named as psychrometer. Psychrometer, it has two temperature settings, wet bulb and dry bulb. We have to measure the wet temperature and also the dry temperature. In between they have to measure the humidity of the air. So the answer is relative humidity of air. Next question is identify the instrument shown in the photograph. Options: Siegel's pneumatic speculum, Pilcher's nasal speculum, Tudicum nasal speculum, and Killian's nasal speculum. The answer is Killian's nasal speculum. So it will help to examine the and treat the diseases in the nose like bleeding, and to remove foreign bodies, and it will helpful for nasal packing, and it will helpful for to take nasal biopsies. Identify the instrument shown in the photograph. This is Luke's forceps. It will helpful for nasal and throat operations. Luke's forceps, it mainly for operations. It is used for removal of thickened antral mucosa, antroconal polyp and neoplasms. And what are the surgeries they have used this forceps for? Anterior antrostomy, submucosal resection, polypectomy and turbinectomy. This is Luke forceps will help. And this instrument is namely called as Vienna nasal speculum. Vienna nasal speculum, it is also used for to treat and expose tissues for rhinology procedures. Mainly rhinology procedures they can use for this Vienna nasal speculum. The next, nerve tested by using clinical test shown in photograph. Which nerve test they have used this testing means ulnar nerve. This test is called as Froment sign. Froment sign. So what it is means, it is a special test. It is used to identify the wrist palsy of ulnar nerve, specifically the action of adductor pollicis. It test positive means what will happen, the paper is pulled away by the examiner because of the weakness, where the patient flexes his thumb and interphalangeal joint in an attempt to hold the paper. They are not able to hold the paper, the examiner pull the paper. So this is, it means the test is positive, the patient is having ulnar palsy in the wrist. Identify the instrument shown in photograph. This instrument is mainly used in general anesthesia. So this is fibro-optic laryngoscope. It is mainly for inspect your throat for any problems or intubations. It will use for a fibro-optic laryngoscope. What is that? So instruments shown in photograph are best sterilized by, so this image is shown the glass materials. So the glass material sterilized by hot air oven. So we will see hot air oven sterilization, what all the things we have to sterilize. First one is glass materials, அதாவது கண்ணாடி பொருட்கள் எல்லாமே வந்து ஸ்டெரைல் பண்ணுவாங்க. ஸோ அது என்னென்னு பார்த்தோம்னா டெஸ்ட் டியூப்ஸ், ஃப்ளாஸ்க் அண்ட் பிப்பட்ஸ். அதுக்கப்புறம் என்ன மெட்டல் இன்ஸ்ட்ருமெண்ட்ஸ், என்னென்ன மெட்டல் இன்ஸ்ட்ருமெண்ட்ஸ் நம்ம ஹாஸ்பிட்டல்ஸ் யூஸ் பண்ணுறோன்னா பிளேட்ஸ் அண்ட் சிசர்ஸ். அடுத்தடுத்து பவுடர்ஸ், இன் கெமிக்கல் பவுடர்ஸ் they are used for hot air oven. Powders like sulfadiazine, starch and zinc oxide. Then materials have oil and glass test tubes. So these are all the things they have sterilized by hot air oven. The next one is, this is research based image based questions. Identify the statistical diagram shown in photograph. Which diagram it is? So the answer is box and whisker blot. So this is otherwise called as box blot or box and whisker diagram and box and whisker blot with outliers. These are the three names. So it is a graphical representation displaying a varying in a set of data. So it shows the multiple sets of data to be displayed in the same graph. Histogram also displayed this type of data, but in this box and whisker blot we have to show the multiple data in the same pictograph. So what is the uses means, when you have multiple sets of data from independent sources that data are related to each other in some way. For example, the comparison between the schools, the marks, test score between schools or test score between classrooms. So this is examples of box and whisker blot. Next one is, what is that? That is sampling technique. Types of sampling shown in figure. Answer is cluster random sampling. So in a research, sampling techniques are two sampling technique, probability sampling technique and non-probability sampling technique. So the cluster sampling technique, it is a probability sampling technique. What they will do, the researcher divide the population into the multiple groups and then they have to taken for selective groups, that is homogeneous groups. They have to select the one or two groups for data collection. That will randomly they have to select either systematic randomization or simple randomization. So in this characteristics, what they will show, that in cluster sampling each group they have an equal chance of being part of the sample. So in the cluster sampling have three stages, three types: single stage, two stage and multiple stage. Three types of cluster sampling. What it is, this statistical diagram shown, what it is means, that is, this is bar graph or bar chart. So bar diagram, so what it is means, it is also the pictorial representation of a grouped data in the form of vertical or horizontal rectangular bars. So this is rectangular bars, it's shown in the data, representative data. So the length of the bar is equivalent to the measures of data, that is bar diagram. So this bar diagram also have a four types: vertical, horizontal, grouped bar graph and stacked bar graph. Four types of bar diagram. Next picture image is, what is this means, it is a scatter diagram. So scatter diagram, it means to examine the relationship between the both x-axis and the y-axis with one variables. So it gives an idea of nature of relationship, either positive or negative correlations, positive correlations. So this will mainly scatter diagram to study the correlations between the variables. So there are the types of correlations: positive correlation, negative correlation, null correlation, linear correlation, exponential correlation and U-shaped correlations. So this is our scatter diagram. So in next question is, in the given scatter diagram, correlation coefficient R will lie between. So this diagram itself we should know first, before we should know the correlation coefficient will fall between the -1 and the 1. This is fixed correlations, but in shown in the photograph, what it shows in the graph is will be negative. So the answer is 0 and -1. So -1, it means perfect straight line with the negative slope, and +1, it means perfect straight line with the positive slope. So you have to keep in mind negative slope and positive slope. So this diagram is shown in the negative slope, and so the correlation R will be the 0 and between 0 and -1. So we have in correlation Pearson formula, correlation coefficient Pearson formula is n sum of xy minus n sum of x sum of y divided by root of n sum of x squared minus sum of x the whole squared into n sum of y squared minus sum of y the whole squared. So this is the formula of Pearson. Next one is Venn diagram. So this is circles, 3 circles. It is an illustration that shows circles to show the relationship among things. So this circle, it shows the relationship with the help using circles. So it may be this circles itself we should know the similarities and differences with the two concepts. So this is Venn diagram. So next one is, what is this? So this machine is an autoclave machine. So this machine is an autoclave machine. So it is a steam sterilizers, autoclave, or also known as steam sterilizers. So it is a machine that uses steam under pressure to kill harmful bacteria, viruses, fungi and spores. So in autoclave have 3 phases. First one is conditioning phase, exposure phase, exhaust phase. In conditioning phase they have to remove all air in the container vacuum in the autoclave machine by the either suctioning or vacuum we have to remove the air. Next one is exposure phase. In this phase, allowing the steam and increasing the temperature and fix the time for sterilization. In exhaust phase they have to removal of steam, depressurizing the vessel and loaded items are to be dry. The temperature it should be kept in autoclave based on the materials size and shapes. So the temperature is mostly 250 degree Fahrenheit or 121 degree centigrade, then 270 degree Fahrenheit, 132 degree centigrade, or 275 degree Fahrenheit, 135 degree centigrade. So this is autoclave. Then identify the placental removal technique shown in the photograph. So this technique is expulsion of placenta by fundal pressure. So they are giving fundal pressure. Through this pressure they can remove the placenta. So placental removal, the active management of third stage of labor is very essential according to WHO. What they are recommending, so they have to administration of urotonic oxytocin, we have to prefer syntocin, and controlled contraction and uterine massage. Then because the PPH is the most common cause of maternal mortality rate, in order to prevent that, so we have to deliver the placenta. Active management of third stage of labor is very essential. What it is means, it may shows the CT-KUB. So this is both the kidneys and this is kidneys, and in CT computerized tomography they are using X-rays to take in the pictures. Identify the position shown in the image. This position is reverse Trendelenburg position. So what are the uses of reverse Trendelenburg position means? So it is mainly used for neck and head surgery and gynecological procedures. Then when the patient is not able to prop up, so we have to maintain this position for NG tube insertion and also the NG tube feeding, and to improve surgical exposure of the prostate gland, and minimal invasive glaucoma surgery, intubation and extubation of the patients. These are the uses of reverse Trendelenburg positions. The next one is the blue color pipelines in OT is used to deliver. So there are the pipelines colors used in medical lines. So in oxygen we are using white color pipeline, nitrous oxide blue color, medical air white and blue color, carbon dioxide grey color, nitrogen black color, vacuum yellow color. So these are the color codings of pipes used in the medical lines. So identify the images. This images is called airway cot. So airway cot, it is an emergency material. So in airway cart we have 4 drawers. We'll see one by one. According to the plan ABCD, the first drawer is plan A. In that we have keep ET tube, other intubation needed things. First drawer. Second drawer, plan B, supraglottic airway devices we have to keep. And third drawer is plan C, face mask, naso and pharyngeal, oropharyngeal airways face mask. In plan D, SICO rescue. SICO means what? SICO, CICO. SICO means can't intubate, can't oxygenate. So this is SICO. In that drawer we can keep cannula, surgical and cylinder, cricothyrectomy techniques and airway exchange catheter, extubation kit. These are all the things we have to keep it in the fourth drawer. So this is the monopolar cautery. This is used for during surgery to cut and ligate and blend and desiccation and fulguration. So this is used for the monopolar cautery. There are two types of cautery, monopolar and the bipolar. So these are all the images asked in previous question papers. So those who like this questions, you can subscribe to me and ring the bell button. You will receive my notifications. Thank you.